Swaziland is not an emergency conflict country, but looking at the reasons why MSF was there, there was need because in Swaziland it's the highest HIV and TB prevalence in the whole world. That in itself is an emergency. The program that I worked on in Swaziland was a comprehensive healthcare based clinic, which MSF supported MOH. So in brief, I will say that comprehensive in terms that MSF took care of all ages and diseases. We had outpatient treatment area. We did non-communicable diseases. We had a drug-sensitive TB department, and we had the drug-resistant TB department in this complex clinic. I will talk of a patient in particular. This was one of our multiple drug-resistant TB patients that got treatment in our clinic, and because of the side effects of this treatment, the patient became deaf. So we had the sign language training. We did train deaf patients that we had in our project. We trained staff because they also needed this skill to communicate with the patients, and we trained relatives of the patients where they come from so that they can also have this skill, they can be able to communicate well at home. So this patient got the skill, and she was very happy when she's home. She could communicate the same with her kids. She did communicate with her parents and the community, and she was accepted back at work. So this is really a story that I feel will never get out of my mind, whereby I think we managed to give back life and hope to a patient who had totally lost hope because of the deafness that she experienced. MSF does give free healthcare treatment for the patients. And in this case, you'll find that even a patient who doesn't have money to come and get medical services will be able to do that. It's because the treatment for the multiple drug-resistant TB is very cumbersome. And for us to achieve, to have a zero defaulter rates, we really did support our patients by giving them food vouchers. We gave them transport. We did take injections to their homes. We did rehabilitate their houses, and that is what they needed. All this we do with a certain objective. We want all patients to be on treatment, and with the public health awareness is that once a patient is treated, then will cause less spread of the disease in the community. So our objective was to make sure that all patients are on treatment and they take the treatment as advised by the doctors and they get cured. That was our main objective. So as much as MSF goes beyond, there is a driving force and there is an objective for that. It's not for just doing it. There is a purpose.